Good evening, doctors. Welcome again. Today we are going to discuss here about Neet PG 2021 exam test series second. Abdominal mass swelling of pyloric stenosis can be best felt by. So, answer here is when the baby is being fed milk. So this is the explanation. Ultrasonography is an investigation of choice for congenital pyloric stenosis, and here we see hypochloremic alkalosis, non-bilous vomiting. This is most mainly seen in boys, and olive shaped mass palpable in mid epigastrium. Okay, now management is rapid correction of dehydration and electrolyte abnormalities, and surgery of choice is pyloromyotomy or Ramstead operation. Now, test based on the principle of physiological responses associated with a suspect reaction to a question is. So this is known as polygraph. Polygraph. Polygraph, popularly referred to as a lie detector test, is a device or procedure that measures records several physiological indicators such as blood pressure, pulse, respiration, skin conductivity while person is asked and answer questions series. A belief underpinning the use of polygraph is that deceptive answer will produce physiological responses that can be differentiated from those associated. Okay, gamma knife mainly utilizes cobalt 60. Cobalt 60. Okay. So a large dose radiation deposited in single fraction. This is explanation. Okay. Which of the following is true about spinal anesthesia? They are asking true. So the best answer here is anesthesia is injected in subarachnoid space. So this one is the best answer. First option, why not? Because analgesia take about 15 minutes. It take spinal anesthesia is 5 minutes only. And it may be lead to intraoperative tachycardia. No. So this is explanation all about spinal epidural. So some most important points I'm going to explain. Spinal anesthesia local injected subarachnoid space between pia and arachnoid matter. Space between pia and arachnoid. So how to pair skin, subcutaneous, supraspinous, then infraspinous ligamentum flavum, dura mater, then arachnoid matter. Now, spinal anesthesia L2, L3, L4 intervertebral disc in adults. Adult spinal cord and at border L1. Whereas in children L4, L5 intervertebral space and spinal cord and L3. This question they like to ask. And analgesia approximately 15-30 minutes in epidural, whereas 5 minutes in spinal anesthesia. And anesthesia spinal causes bradycardia, hypotension, dyspnea, but they are asking tachycardia, so not tachycardia. Hope it's clear. Now, the image shown here, what is it? So this image shown here, this round image is tinea. Answer here is tinea. Tinea corporis often begins as a pruritic circular or oval erythematous scaling patch or plaque that spreads centrifugally. Central clearing follows while an active advancing raised border remains. The result is an annular ring-shaped plaque from which the disease derives its common name, ringworm, ring-like worm. Okay. Variable declaration is seen in. This variable declaration mainly seen in cord compression. Let's discuss individually. Like late fetal heart declaration seen in case of uteroplacental insufficiency or fetal distress. late fetal heart, whereas variables seen in oligohydramnios and cord compression. Okay, now early fetal heart rate declaration seen in head compression or the stimulation of vagus nerve. Hope it's clear. Now, the needle here shown is number. Which number of blade is it? This blade number is 11. 11. How to memorize? Let's see all number. This type of blade is 10 number. This type is 10A. And this very sharp is 11th. And this one is number 15. So, let's discuss individually 10. One of the more traditional blade shape, it is generally used for making a small incision in skin and muscles, 10 number. Whereas 11th, design ideal stab wounds procedure, incision, chest drain, opening coronary arteries, opening aorta, removing calcification in aortic mitral valves. Whereas 15, popular blade shape, ideal making short pierce incision, utilizes surgical procedure including excision of skin, recurrent sebaceous cyst, for opening coronary arteries. Hope it's clear. Now, which of the following is not true about treatment of severe hyperkalemia? Not true, they are asking. So, calcium gluconate causes transcellular shift of potassium? No, it never causes. So, answer is this. Rest other are no. Perfect. They are asking not, so not is this. So, calcium gluconate onset of action within 5 minutes of administration? True. Calcium gluconate is the fastest acting agent? True. Most effective and rapid way of lowering potassium is by hemodialysis? Absolutely right. So answer is A here. These all explanation you can pause this video and read by your own. Now, identify the type of joint shown below. So this is a case of synovial joint. This is synovial joint. Okay. Hormone predominantly secreted after day 14th menstrual cycle is. So answer is progesterone. Progesterone is secreted after day 14th of menstrual cycle. Heme synthesis requires. Heme synthesis require, write in a comment box what is the best answer here. Trelli, transfusion related acute lung injury. Which one is the best answer here? The best is high titer anti-HLA antibodies in recipient plasma. Anti-HLA antibodies in recipient plasma. Okay, TRALI is the most common cause of death after blood transfusion. Remember questions. It is frequently associated multiparous female donor. Features of TRALI: smoking, a chronic alcoholic, shock, liver surgery, transplantation, mechanical ventilation, positive fluid balance. Presence of high titer of HLA class 2 antibodies, donor plasma, bind recipient leukocytes. Leukocytes aggravates pulmonary vessels and inflammatory mediators. Hypoxia, sign, non-cardiogenic edema, etc. And treatment is supportive with proper oxygenation. No definitive treatment is available for TRALI. Most cases resolves within 3 days. Drug acting on S phase of cycle. So answer is methotrexate. Methotrexate acting on S phase of cycle. Candidiasis of penis is. This is known as balanitis. Candidiasis of penis is known as balanitis. Let's discuss. Axilla under peduncles, breast, groin, intragluteal folds is intertrigo. Glans penis, candidial infection, balanitis. Follicular pustules is candidal folliculitis. Nail folds, candidial parenchyma. Mouth and tongue, oral candidiasis, thrush. Mouth and tongue, thrush. Area included under diaper, it's dermatitis. So, culture obtained from the lesion shown below demonstrates branching with narrowed ends. What is diagnosis? Diagnosis is Candida albicans. If a person willingly produces false evidence under oath, he is punishable under section 193 IPC. Most characteristic cardiovascular defect seen in rubella is pulmonary artery stenosis. Let's discuss. Classical triad congenital rubella is sensorineural deafness, 58% patient. Eye abnormalities, cataract, glaucoma, microphthalmia, 43%. Congenital heart defect, especially pulmonary artery stenosis and PDA, patent ductus arteriosus, 50% of patient. Spleen, liver, bone marrow problem, some of which disappear shortly after birth. Intellectual disability, etc. You can read. Now, 10-year-old boy is so restless all the time in the school. Rest of the class is unable to concentrate because of him. He is hardly ever in his seat, be it at home or school. He has difficulty in playing quietly. He does not listen to his mother at all. The most likely diagnosis is this is a case of attention deficit hyperactivity disorder. This boy is suffering from. Okay, half-life of tritium is 12.3. Tritium 3, so 12.3 tritium. Okay, so half-life of all is strontium 28, radium 1622 years, technetium 6 hours, all half-life here. Which of the following is true about spinal anesthesia? We already discussed. Answer is anesthesia injected in subarachnoid space. Now, a patient with normal succinylcholine metabolism will have Debouquin number between, so answer is 70 to 80. Let's discuss why. Debouquin number is normal is 80 or more. Heterozygous enzyme is 40 or 60, whereas homozygous is less than 20. Okay. A child is presented to the OPD with a lesion shown below. At birth, the child was found to be wrapped in a membrane. What is the diagnosis? So this is a diagnosis is lamellar ichthyosis. Lamellar ichthyosis. Okay. Which of the following is not a soft tissue marker of Down syndrome on USG? On USG, we see increased absent nasal bone, exophthalmos, but no polydactyly. Polydactyly, one film star Hrithik Roshan also has. Okay. Now, what kind of retractor is seen here? This is an Morris retractor. This one is an Morris retractor. Here is Langenbeck retractor. This one is Morris retractor. Remember. Which of the following are the extraintestinal manifestations of Sippel syndrome? Sippel syndrome is MAN2A. Multiple endocrine neoplasia 2A. It includes cutaneous lichen, amyloidosis, Hirschsprung disease D. So all the above is the answer. MAN1 is pituitary adenoma, hyperplasia, parathyroid hyperplasia, adenoma, or pancreatic hyperplasia. Whereas MAN2A, hyperplasia, adenoma of parathyroid, and pheochromocytoma, and C-cell hyperplasia, medullary carcinoma, cutaneous lichen, amyloidosis, Hirschsprung disease. Okay. Now, how many doses of monovalent meningococcal C vaccine is given to infants? That is 2 doses. 2 doses. Simple mastoidectomy is done in which of the following indication? That is mainly done for acute colisant mastoiditis. So guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me. And if somebody is new on my channel, please subscribe it. And if you like this video, put like on it. Thank you.